Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers, Directors General and Directors, ladies and gentlemen. I join the Secretary to the Government of the Federation in bringing you all special greetings on this special International Workers' Day, which also marks 64 days since the index case of coronavirus appeared in Nigeria and caused the onset of the COVID-19 pandemic in Nigeria, during which much has changed. The daily course of our lives has been disrupted, and the number of persons affected by the disease has continued to rise. Among countries of the world, we have seen horrendous fatalities, livelihoods destroyed, and economies shut down. This virus has affected all of us, from those struggling to survive to those struggling to return home from abroad, and it has even forced changes right at the heart of governments. We have survived many past epidemics, but COVID-19 has been the most difficult and damaging that nations and healthcare systems have faced in recent times. It hasn't been different for Nigeria. With regard to the COVID-19 infection, only 2 states have not yet reported a case at all. 204 cases were reported in the last 24 hours, Kano being 80, Lagos 45, Gombe 12, Sokoto 9, Bauchi 9, Edo 7, Borno 7, Rivers 6, Ogun 6, Federal Capital Territory 4, Akwa Ibom 4, Bayelsa 4, Kaduna 3, Oyo 2, Delta 2, Nasarawa 2, Ondo 1, Kebbi 1. 12 patients were discharged in the past day, 7 in Lagos, 2 in Ogun, 1 in Akwa Ibom, 1 in Edo, and 1 in Sokoto, bringing the total number of those treated and discharged to 319. These numbers speak for themselves because the 204 cases, new cases, are the highest count yet. We now have nearly 1,000 in Lagos and more than about 219 in Kano. We have sadly lost 51 persons, each one painful and difficult to share. On behalf of the government, our prayers go out to their families. We have discharged, as said, 319, a number that we are working to increase daily. So there is hope on coronavirus. We have now activated 18 laboratories nationwide to increase testing capacity and improve case management. Partners and Nigerians, both home and abroad, are volunteering to serve and support our efforts. But the tribute I pay today is to the workers of our healthcare system. Doctors, nurses, lab technicians, scientists, and unsung heroes like cleaners, drivers, clerks, ad hoc staff are the Nigerians in the front line. We know that many offices have been working nearly 7 days a week since the outbreak started. Others, more, have stretched themselves almost to capacity, but are still going strong, showing the Nigerian capacity for resilience and fortitude. I say to you all, Happy Workers' Day, and to their families, thank you. We will do all we can to protect your family and your loved ones. We can support the health workers by following the advisories. Stay home, wear your mask if you must go out, observe hand and respiratory hygiene, and observe social distancing. I also seize the opportunity to call on health workers to continue to follow laid down standard infection prevention and control measures, to protect themselves, and to treat every patient with care and with attention. But please do not refuse anyone care. With regard to Kano, a multi-sectoral team of 14 specialists comprising of persons from NCDC, NPHCDA, that's the National Primary Healthcare Development Agency, the Department of Hospital Services, the Department of Family Health, infectious disease specialists from IROA, media, and the special advisor will leave for Kano in the early morning to support that state in all areas of response. The main focus of intervention is on training, and capacity building of state healthcare workforce along the various specialties on a very massive scale. On case management, medical, nursing, and cleaning staff shall be trained or retrained. The National Primary Healthcare Development Agency will engage its extensive Kano State network to drive testing demand at grassroots through community mobilization so that NCDC testing strategy can be realized. We get complaints, unfortunately, about patients who suffer from other ailments not being attended to even in private hospitals or public hospitals in this era of COVID-19, which raises concern for immunization, reproductive, maternal, neonatal, and child health, and routine service coverage. A senior official from the Department of Family Health, from the Ministry of Health, is therefore also on this team to go to Kano to help drive the continuation of essential health care, even at private and public hospitals. We shall do all we can to combat this virus, but we cannot do it alone. I earlier mentioned the several outbreaks we in Nigeria have overcome. We, as a nation, must rally together to show how strong we are to handle coronavirus. Thank you.